Welcome everyone to our webinar today on the Pain Management Best Practices Task Force report. We're going to talk about our ask for our Virtual Advocacy Day and how to take action. I'm Cindy Steinberg, National Director of Policy and Advocacy for the U.S. Pain Foundation, and I'm going to be joined by my colleague, Emily Singh, Emily Lemiska, who is our Director of Communications, and we have a special guest today, Dr. Vanila Singh, who was the chair of the Pain Management Task Force. So let's get started. Here's an agenda that we'll go over today. First, I'll talk about the report, give you the background of the report so you'll understand why we're asking Congress to fund it. And then Emily will talk about how to participate in our Virtual Advocacy Day, which is this Thursday, June 11th. Dr. Singh is going to talk about why the report is so critical to the future of pain management. And then we'll take some Q&A. I just want to mention Dr. Singh is a practicing pain doctor and she is in clinic. So she might pop in, which we'll just take a break from what we're talking about to have her give a few words, and then we'll go back. So why was this report created? Congress wanted to know what pain experts consider best practice in pain management. And Congress also asked the task force to review the CDC guidelines. The Pain Management Best Practices Interagency Task Force was written into the Comprehensive Addiction and Recovery Act, or CARA, in 2016. It was Section 101, the first section and the only section pertaining to pain management. And the law specified that the work of the task force was to be overseen by the Department of Health and Human Services, so the Undersecretary for Health, which is above all the other health agencies in the government. The charge to the task force was to identify gaps and inconsistencies in best practices for pain management for the nation, and then to propose updates to these best practices and recommendations for addressing those gaps. CARA was very specific about the types of experts that should be chosen for the task force. There are all of the members up on the stage. About half of the task force were from other federal agencies, other health agencies, which is why it's called interagency. So there were 29 members, and all of them were appointed by the U.S. Secretary of Health and Human Services, Alex Azar. The chair was Dr. Singh, who was the chief medical officer for HHS in the Assistant Secretary for Health's office. And lucky for us, she is a pain physician. I was the only patient and pain advocate appointed to the panel. Almost everyone else were doctors of one kind or another. The development process was extensive. It was thorough. It actively sought patient and public input. The task force, as I mentioned, was incredibly diverse. We met every 2 weeks for nearly a year. It was an extensive amount of work. We reviewed about 500 references, which are in the report itself in the back, and got over 9,000 comments, which was an exceedingly huge number of comments for a administrative report like this. About 80% of them were from patients, the others were from organizations and any other people with an interest in pain. We also took testimony, public testimony, during our public meetings. The meetings were live streamed, and in addition to the comments and patients who came to speak during the public session, we also invited patient testimonials from pain patients who had communicated with us. Many government leaders spoke, so there's a picture of Jerome Adams, who you might recognize as the Surgeon General. Alex Azar, the HHS Secretary, came, the Assistant Secretary for Health, Admiral Trewar, the FDA Commissioner, the physician members of Congress came, like Senator Cassidy, the chief medical officers or deputy medical officers from the VA, from the Indian Health Service, and also from CMS. So what is in the report? The report is 72 pages. It is quite broad. and includes all these topics: acute and perioperative pain, although most of the focus is on chronic pain. Medication, like 6 different classes of medications that can be used for pain, restorative therapies, interventional procedures, psychological interventions, complementary and integrative therapies, considerations of special populations. There's a big section of the report that deals with special populations, minorities, health disparities, pediatrics, women, sickle cell disease, and other chronic relapsing pain conditions. Stigma as a barrier to treatment, education, access to care, and then the review of the CDC prescribing guidelines, which were asked of Congress asked us to do. So overall, if we could summarize kind of the highlights of the report, the first is that pain is an enormous public health problem with profound individual and societal consequences. The report stresses individualization of care throughout the report. That individualization is required in what therapies are selected, in considerations of risks and benefits of each therapy, in the duration of treatment, as well as the optimal dosing of medication. And then multidisciplinary care being really essential. The best practice in pain management, really state of the art, is multimodal, multidisciplinary, integrated model of care that includes full range of pharmacological and non-pharmacological treatments. Stigma was an important part of this. It's a major barrier to treatment, and it's critical to provide education and awareness of the fact that pain can be a disease in itself, which is not generally known, and that doctors really and other health providers need to have empathy and a non-judgmental approach to people with pain. There's not enough education, both public, private, provider, and even policymaker education is critical really to the delivery of effective patient-centered pain management, and is really necessary for optimizing outcomes. That special populations face unique and complex pain challenges, and they must be understood and addressed. Children, youth, women of color, pregnant women, as I mentioned, the elderly, veterans, active military, these groups really deserve and require specialized support and interventions. An individualized approach to opioids. Opioids have a role to play in pain management, and the risk-benefit balance for opioid management must be considered on an individual basis, as there is wide variation in factors that affect the optimal dose of opioids. The report received an overwhelmingly positive response. It was completed 1 year ago, in May of 2019. Over 160 organizations endorsed the final report. It included patient groups, other health provider groups, companies that work in this space. US Pain strongly supports the report. One very nice thing for us was that the AMA was very enthusiastic about the report and issued a press release calling it a roadmap for future policy. And Dr. Patrice Harris, president of AMA, you may have seen her on TV, she's been on a lot these days, came to our last meeting and gave a really very wonderful speech and said these recommendations are a lifeline to pain patients who've been caught in the middle of policy efforts that have produced harmful unintended consequences. These are some other endorsements from Human Rights Watch, who's been vocal about the way people with pain have been treated, from the Association of American Physicians and Surgeons, the Consumer Pain Advocacy Task Force, which is a group of about 16 pain patient organizations, the American Academy of Pain Medicine, the American College of Physicians, are just some of the organizations that endorsed the final report. So what are we advocating for? I've been doing pain policy for about a decade and have realized that nothing happens unless you make it happen with Congress. The squeaky wheel really gets the grease. It's really important to make our needs known to our Congress members. And the more people that do, the more they realize this is something we need to pay attention to. Numbers really matter in a democracy. And this is where our advocacy comes in. We want Congress to appropriate funding to implement the report recommendations. The report really was just the first step, and unless we get funding and Congress behind this, not much is going to happen. Now, there are many recommendations in the report, as you'll see if you've already looked at it or if you take a look at the actual report. So we kind of have two specific asks. If Congress members say to us, what would you want from the report accomplished? One is a national public awareness campaign on chronic pain and the differences between acute and chronic pain, which we feel is very little understood by the general public. And then dissemination of the key findings to our nation's primary care providers who really have to care for the bulk of the 50 million Americans that are living with pain. There are just not enough pain doctors. And that individualized, multimodal, integrative care is really best practice in managing pain. I am now going to turn this over to Emily Lemiska, who is our Director of Communications, and will tell you about our Virtual Advocacy Day we have planned for this Thursday. Emily?
Hi, everyone. I'm so glad to be here with you. So I'm just going to take over. Actually, I'll wait to share my screen in just a second. I did want to say we're getting a lot of people typing questions into the Q&A. We will take those at the end, but please feel free to keep entering those in, and we'll see them as we go and respond at the end. So I'm going to talk about Thursday and all the awesome ways that you can get involved and help us make this ask and flood policymakers with our request that they allocate funding for these key recommendations in the report. Next slide. So like we said, it's Thursday. We're going to dedicate the entire day to this ask, because the reality is, like Cindy said, unless we reach out and make our voices heard, nothing's going to happen with this report. Policymakers need to hear from us. So we've created all the tools that you need to take action and to do so easily and from the comfort of home. We have a system for making phone calls that includes talking points for you. We have a customizable template email. We also have some sample social media posts. And of course, we have some fun graphics and visuals to help you spread the word, because the more the merrier, and we welcome you to invite family, friends, anyone in your community to take part in this campaign. So we have the tools, but we need your voice, we need your passion, we need your story, and we need you to help us advance this report. Next slide. Okay, so I'm going to start sharing my screen, and I'm going to walk you guys through our website that we've created. So Cindy, can you see my website up on the screen up here? Great. Okay. So this is our advocacy portal page. It's just uspainfoundation.org/advocacy day. Up here, it just talks to you about, what we're doing and why we're doing it. This is information about the webinar, which you guys are all on, obviously, so great job. But this is really the important part of this site. This is where you have all the tools for taking action. So the first one is to call your legislators. And I'm just going to quickly walk through and show you guys exactly how this works, just so you feel comfortable. So I would just click here to make the call. And all you do is you fill in your information. So I'm going to type that in here. And this is what allows the program to direct you to the right representatives. And down here, you can hit remember me, so the program will automatically populate your address information next time. You can also choose to sign up for our mailing list or not, no big deal. But you hit submit, and it brings up these step-by-step instructions. So it shows me my 2 senators and then my 1 representative. And right now it's giving me my phone number for Senator Murphy. So I could just call that number, and then we have talking points here. And we did include quite a few talking points, but we definitely welcome you to paraphrase. I would say that point 1, point 2, and down at the bottom, point 5 are the most important, but you're welcome to customize these as you see fit. Again, add in some of your personal story. These are just sort of a starting point for you. And then down here, you can tell us whether or not you made the call, And you can also give us some information about how the call went. So you could say, great convo with an aide. Because the reality is you're probably not going to speak to the legislator themselves. Most likely you'll talk to an aide, and that is perfectly great. Those aides will pass that information along, or you might just leave a message, and that's okay too. So if you wanted to make another call after you've made that one and you saw how well it went and how easy it was, you would just hit next call. And it tells me, okay, so you've called Senator Murphy, next call Senator Blumenthal, and it gives you his number. And when you're all done, you just hit, I'm finished making calls. But it's very easy to do. I would really encourage you to try that out. It might seem scary, but I promise it's not. They take calls from people all day about all sorts of things, and they want to hear from you. So next, let's try the email button, which again, super easy to do. Just click that. And because I hit remember me last time, it already has all my information in here, which is great. Make sure it's all filled in, and I'm gonna hit submit. And then this brings up the template email that we've pre-written for you. So you can see, we kind of make the case for why this report is so important. We talk about a lot of the things that Cindy just went over as far as all the great things in the report, calling for multidisciplinary care, improving affordability of treatment options, who's endorsing it, and then of course our asks. You are able to customize this email. So if you choose to, you can add in a little bit about your personal story. Sometimes that can help get people's attention. We welcome you to do that, but if you're short on time and energy and want to just hit send, that's fine too. And you can see up here again, it's automatically putting in my senators and my rep, so I can just send it to them automatically. And I would just hit submit, and that would be all done. So it's very easy to do the email. We definitely encourage you to make sure you use that. And the reality is, even the legislators get a lot of emails. If they see a ton on one issue, they're going to start to pay attention. And finally, we have the option to tweet your legislators. This one's a tiny bit more complicated than the other two. So what you do is first you have to look up your legislators' Twitter handles. So you hit this link here, and it's going to take us to this page where we can search for our legislators' Twitter handle. So I'm going to type in my zip code here. And it's a little quirky because it actually gives me all of Connecticut's representatives and senators. But fortunately, I know that Rep. John Larson is my rep. And I know that because when I did the emails and phone calls, that's what it told me. So that helps a little bit. So I'm just going to copy his Twitter name right here. I'm going to come back to this page. And I'm going to hit tweet. And Cindy, I want to make sure you can see this.
I can see.
Okay. And it's going to pull up this automatically written tweet, which is really cool. So hopefully y'all can see that, and basically says what we're asking for, but it's short and sweet because it's Twitter. And all I'm going to do is I'm going to paste in John Larson's name. And I'm actually, I can just hit tweet and it will go out. And that's a great way to get legislators' attention too. As you know, they're very commonly on Twitter. And if they get a lot of tweets about something, again, they start to pay attention. So those are the main ways that you can take action on this page. We hope that you do all three of them, but even if you just do one, that is wonderful, and we really appreciate it. And again, it doesn't have to be just paying patients. It can be family members, caregivers, doctors, anyone, doesn't matter. The more voices, the better. And once you're done taking action, you can help us also by spreading the word about this day and about this campaign. So if you scroll down here, you'll see we have a few different graphics that you can download, and you can use those to post on your social media and let folks know what we're doing today and encourage them to take part. We also have this cool little template that we're asking you to download. You can print it out and then fill it in. And I actually made my own earlier today, so you can see. And I wrote in, I am an individual and I need individualized care. So later today, I'm going to post this on Twitter and help spread the word that way. And I'm going to use that hashtag, a plan for pain. But I invite you guys to do the same. Basically, we just need to make a lot of noise surrounding this ask and get people on board. And finally, I just wanted to point out that, Cindy went over the report. It is a huge document. It's 72 pages. But if you want to know more about the report and be able to read it because that's easier for you, we do have a link to the report on this page at the bottom. We also go over the key takeaways from the report here, so you can read through those if that's helpful. We list some of the endorsements at the bottom. So there is a lot of great information on this page. It's really a one-stop shop for everybody to take part. So we hope that you do on Thursday. And if you have any questions, let us know. So I'm going to stop sharing my screen and turn it back over to the slides with Cindy.
Thanks, Emily. Really appreciate it.
No problem. I think I might have one more slide up there. My final rallying cry.
Okay.
So next slide. Oh, so something else that I wanted to mention. If you do hear back from your legislator, please let us know. We'd love to hear if you get a positive response from them. Maybe you get a personal email from them. Maybe they contact you and say, you know what, let's have a meeting about this. That would be incredible. But we're here to help you with that. We have handouts, resources. We can kind of just give you whatever tips you need for going into a meeting. And obviously, you know, a lot of people, they're probably not hosting in-person meetings right now, but a lot of legislators are still doing meetings over teleconference, or their aides are doing meetings over teleconference. So you might get asked to do that. And if you do, just send an email and we can hook you up with some great resources. Next slide. So here's my final rallying cry. Again, anyone can participate in this campaign. It is so important. The reason we're doing it all in one day is because, you know, the bigger the push, the more noise they hear, the more likely they are to stop in their busy day and pay attention. And obviously, you know, there's a lot going on in the world right now, but they're making the budget for next year. So this is our time to act and try to get some funding behind this report. And so that's why now is so vital. And why we need to really bring some attention to this issue. And again, invite everyone you know to take part. Doesn't have to be someone with pain. You know, tell your neighbor, anyone. We'd love to have them participate. So, seems like right on time, Dr. Singh.
Unbelievable. How perfect.
Right.
Hi, Dr. Singh. So that was amazing. We didn't really time this like this, but you just came in at the perfect time. So I want to introduce Dr. Vanila Singh, who was the task force chairperson. She was our leader, and she did an amazing job. Dr. Singh is a pain physician at Stanford. She just stepped away from seeing patients to hop on for us. She is a clinical associate professor at the School of Medicine. She was the former chief medical officer of HHS in the Office of the Assistant Secretary, and she chaired our task force report. And we brought Dr. Singh on to tell you how important it is that you let Congress know about this report. So Dr. Singh, thank you, and I'll turn it over to you.
Thank you, Cindy. Can everyone hear me okay?
Yes.
Excellent, great. Thank you so much for inviting me. I'm always such a great admirer of the U.S. Pain Foundation and all the amazing efforts that all of you who are true warriors in this fight to advance the cause of patients with chronic painful conditions. What Cindy just said is true. It was really, truly an honor to be able to serve at HHS and specifically chair this very, very important task force. And why it is important is a multitude of reasons, but if I can just step back, I've spent 16 years here at Stanford treating patients with pain, and prior to that I was at UCLA, and I've spent my career in this realm from acute to chronic, and that's really what our best practices interagency task force was addressing. It's a congressionally mandated effort that really came from the CARA legislation of 2016. Many of you may have known this because you have a huge advocate in Cindy Steinberg, who was such a phenomenal patient advocate, who really did so many folks a great justice. She fought real hard and was an example of that which we are trying to fight for. But Congress correctly identified this as a very important means in kind of the larger backdrop of the opioid crisis, which we really know is an illicit drug crisis. A lot of good people have been swept into this, adversely affected, whether intentionally or not. And what's really amazing about what the task force did was that it was HHS convened. From that, my role came with the DoD and the VA. So we had really everyone in that sphere at the US government agency levels, plus the White House Office of National Drug Control Policy. But they even went a step further and they made sure we had experts not just in pain, but in mental health, in psychology, in the various subspecialties that deal with pain, clinicians who have surgical background, who have hematology with sickle cell disease, who represented our veterans, oral surgeons, orthopedic surgeons, fibromyalgia. They were disease specific, discipline specific, acupuncture, social workers. We had input from across the nation. We had 150 plus organizations who were actually critically thinking, giving us input, and were invited, including the Indian Health Services, CMS, the AMA, the American Association of Hospice and Palliative Care Medicine, and the various different orthopedic surgeons, the neurosurgeons, the folks who were represented from the American Association of Nurse Anesthetists. I mean, every discipline, and we really incorporated that. And we did it because we knew it gave us credibility. This is not any particular specialty specific. It is something that was clearly affecting anyone who's really working in healthcare, all stakeholders, whether clinical, payers, whether they were bringing a different perspective from a psychological or social perspective, and of course the biological perspective. So I just want to implore you, it was a unique event in the sense that we got all these wonderful experts on our task force, and we also included so many organizations across the United States, and we were patient-centered. At every single public meeting, we had patient testimonials, so we ensured that we were in the trenches, on the ground, hearing from the very people who are affected by this, and letting that largely drive what we knew to be the major concerns. And then we wanted to ensure that it allowed, whether you're a researcher, an educator, a clinician, or a patient, or in any other realm, that there were parts of this report that gave you the tools to go ahead and advance your already dedicated efforts. Because if we just spoke to, say, 10 recommendations, it's almost meaningless, because we know you need the full support. So we went into all the treatment modalities. We had a no one size fits all approach. We had a patient-centered, individualized general theme. We laid out all the various modalities that could be used, because people are different and they have different comorbidities, they have different causes and mechanisms of their pain. But then we laid out 4 really important policy pillars to help support those efforts, and that was in education. It's a specific section on stigma that was really rooted in the fact that so many patients with pain are really affected by stigma, as assumptions are made about who they are, and really takes away the dignity. And then, of course, risk assessment, the risk-benefit analysis that goes into what is an appropriate treatment, that nothing is without risk, but we want benefits over risk, and we want to be able to have that conversation with our patients in a therapeutic alliance. And then finally, really considering access to care, not only just from an insurance perspective, but that there's enough folks who are trained at the very primary level, but also having enough specialists accessible. And we were ahead of our time. We were all about telehealth too, both in behavioral therapy or traditional for primary care, for specialists, to ensure no matter where you live, you can get the access, whether it's a one-time consult with a specialized person, or that, that person, that doctor or that nurse practitioner could actually get training through telementoring. So we were really on this. I think that we are poised for, making the access issue very big. And I've also been happy to see that right when we went into the COVID era, telemedicine immediately started to include and make it easier for pain patients. The only issue, of course, is that not everyone implemented or knew about it, but that's what the US Pain Foundation is for. And I was really honored to get on, and I wanted to come on today because it's so important that every one of you feel activated from your own specialty lens or perspective. And when you speak to Congress, they need to know that this unique an effort that really took the life out of us. We work 24/7 with so many different stakeholders, is poised, it's even, it's fair, it's scientific, it's compassionate, and it should be translated into implementation at all levels, whether it's the federal level in terms of what goes on at HHS or DOD, and that's like the upcoming CDC guidelines, which we know public comment is coming up, to the private level in terms of helping support innovation so that folks feel like there's a sense of hope in that their suffering and what they've gone through is still going to translate as valued and is going to mean something, to the academic level, training, teaching, and supporting those efforts. These organizations like US Pain Foundation, those organizations like ECHO, which tries to help teach people, have funding for their efforts to relay education and understanding of what is involved. And so I could not tell you how much I'm excited about this. There are a lot of different groups that are really turned on to this. You know, everyone was a little worried right after the task force, but I knew that our bigger work would really be to translate this into implementation and eventually translate into just better clinical care. We have to do it. We have no choice. And I would be really sad to see that the efforts ended there, but they don't. There are a lot of different good people who are with great organizations trying to do this. So I'm really actually happy to answer questions. I don't know if we have a Q&A moment. If there, Cindy, you want me to get into any specifics?
Yeah.
Yes, but let me just say before that, that you see why I said what a great leader we had in Dr. Singh. We were just so lucky to have her as head of the task force. She is totally patient-centered, as you could see, and absolutely right that at every single session, she made sure that we heard from patients. So thank you, Dr. Singh, for all you've done for people with pain to get this report out and to get it known and to keep the focus on patients. So with that, we will take questions on anything that we covered today. And now we have Dr. Singh. Emily, I think you have the ability, people, to write your questions into your Q&A box. And so if you do, Emily, I'm sure you've probably gotten some already. So if you can let us know.
Yes, we've gotten a lot of great questions. I've been answering some of them, just typing it as we go, but there's a couple I wanted to save for you, Dr. Singh, and Cindy as well. One question is from Julie, and she was wondering if contacting governors would be at all helpful regarding the report.
Dr. Singh, do you want to take that or do you want me to?
Sure. Well, I'll give my perspective. One is a lot of times a heartfelt, great letter that you've supported with lots of things can go to many different folks. So, if you've put in the effort for it to go to Congress, I would absolutely send it to your governors. The National Governors Association should also get it, the NGA, as well as your own individual governor who are, what motivates them is their constituents and getting elected. So utilizing that. And so when you make the effort for any elected or unelected official, just change who it is. You can target it a little specifically to the state so it's relevant to them. It arms them with great knowledge, and then they start to feel like they can have you as an ally, which works better in my humble view. It doesn't mean I know the answers, because when we sometimes make it us versus them, you lose that sense where sometimes they can feel like you're someone who can help them. And so arming them with knowledge and then saying, hey, we have the solution to this and we're here to help type of thing, I think that really goes a long way.
So I would definitely second that for sure, right to your governor and your state rep or state senator as well, because certain things are controlled at the state level versus the federal level. So things like continuing education for physicians, insurance coverage, that's controlled at the state level. So one of the things you can certainly ask for with the governor is to ask for more education for physicians and to ask for coverage, insurance coverage of more therapies that are maybe not now covered, but you would like covered. So.
Thank you. Another question, and Dr. Singh, I know you have limited time, so if you need to jump off at any point, just let us know.
Actually, it's okay right now. I was actually getting on. That was the big thing. I had to wrap it up there. Yeah, so we have a little bit of a break, so we're good. Thank you.
Great. So we had another question from Isabella, and she was wondering about, is there any, kind of benefit to advocating with practitioners? So like when you're at an appointment, might there be should you maybe bring up the report, see if they've heard of it? I don't know what your thoughts are.
Oh my gosh, yes, please, because it's all about how things get communicated. People are just overrun with emails, and no one is surfing hhs.gov. I used to joke about this when I would go and and I still do actually when I go and give talks. Like, it's the most impactful place for policy on a national level, but no one is going and looking at it. And so you realize we have to get the word out. And what better way to do it as being a patient who is, understands the challenges and then sharing it and saying, just so you know, this is something that happened, that's huge effort, it's in process of being implemented. If there's anything you can do, or can this be useful for you? Because it's intended for all audiences. We wrote it scientifically to get the respect of our peers, but in a manner that any lay person, any patient, anyone who's just interested in helping can look at it and understand that. So it was really intended for really everybody, and the patients are the best in terms of really garnering that understanding on a individual basis, but also having that relationship with their clinician, their doctor, their nurse, and really spreading the message. I think that is superb. I would love that.
And I just want to add to what Dr. Singh said, that the task force actually created a number of terrific graphics and fact sheets. So you can actually at US Pain, we can make those available on our website. And we'll think of an obvious place to put them, but you will be able to sort of download those graphics, or you can go to the report and print those pages with the graphics. And they're just a great way to get a snapshot of what's in the report. There's one that everybody remembers, which is that toolkit picture that we worked over as groups. I remember getting that right, which really sort of quickly lets you see that everybody needs a individualized plan from choosing from lots of different options that might work for each person's pain. So I encourage you to get those graphics and bring them to your physician.
Awesome. Yes, we'll add those to our toolkit page. And
yes, thank you.
Some folks have asked if that will be up past Thursday, and yes, it will. We are encouraging you to take action on that day, just because it helps create that big burst of awareness. But if you need to take action afterwards, that's totally fine. So another great question we had was from John, and he's asking, who are the key congressional supporters of the task force report and chronic pain issues, or are there people that you should be sort of targeting on this advocacy day? Dr.
Singh, I know you advocated with the doctors in Congress.
Yes, yeah, so absolutely, such a great question, and Cindy has, this really down pat at both the Massachusetts level and the national level. But I will tell you that Senator Bill Cassidy is an ally of ours. He came and spoke at every meeting I invited him to, even when it was last minute. And he's out of Louisiana, but it doesn't matter what state when they're at the national level. He's the one who will introduce. We were hoping to have hearings. I know he's been a big proponent of it. And he remains a very strong ally in the sense of, one, he knows the task force exists. He came to speak at everything. It actually changed his view, as he openly states. He was a GI doctor. He's one of those docs who misses it, actually always is proud to note that he took care of a lot of folks at the county level. And so what I always sense in him is that empathy, that I think he still feels that. So you would be doing him a great service. Mention myself, mention the task force. Also Phil Rowe, he's congressman out of Tennessee. He also came, one of our task force members, John McGraw, is an orthopedic surgeon, worked very closely. So Phil Rowe used to be, I believe, an OBGYN doctor, and so he's out of Tennessee. Dr. Mike Burgess out of Dallas, Texas, was also former OBGYN, had a lot of interest, and I think he would even have more interest if you go, so he's one of those that would be great to sort of say, hey, you know, Doc, we really want you to be a part of this. There's actually a list of folks that I think Cindy and I can probably talk and get to people of different lawmakers on both sides of the equation. You know, this is a nonpartisan issue, and I really want folks to know and feel that. There were a lot of people who you gain their interest by talking about opioids, but really the direction should be that what we are stating is really about helping people who are socioeconomically hugely affected, and it gets them back to functioning and work, and it's a compassionate thing to do. And but you know, utilizing that gets a lot of folks to start to think about that pain is very much this underappreciated public health issue that affects so many people. I mean, right, over 20% of the nation is highly impacted. And so I'm happy to get that list. I think there's a couple of others who are looking at this from the law enforcement opioid perspective, but we were able to change their minds. And Cindy, am I forgetting someone who?
Yeah, so what was really important is that the Senate Help Committee was so interested in pain that they did a hearing on pain. And Senator Lamar Alexander is a big supporter of pain issues, as is his co-chair and ranking member, Patty Murray. So if you're from Tennessee or Washington State, for sure. But any members of the Senate Help Committee, which is the primary health committee in the Senate, Dr. Cassidy is on that committee, Lisa Murkowski is on that committee, was very vocal about pain. So those are great people to target. On the House side, in Energy and Commerce, Subcommittee on Health, Anna Eshoo from California is the chair of that, would be really important. And then of course, we're really focusing right now on appropriations. So the Appropriations Committee in the Senate and the Appropriations Subcommittee in the House is incredibly, the Health Subcommittee is really important for us to focus on, because they're the ones that provide the funding. And right now it's appropriations season. And that's why our ask is really focused on appropriating funding for some parts of the report. So along with the doctors that Dr. Singh mentioned, I would certainly target members of the appropriations and the health committees in both the House and the Senate.
And that brings me to my next question. We have so many good questions coming in. This was from Lisa Marie, and she was asking me, how do you find out if your representative or senator is on an appropriations committee? And also someone asked sort of a related question, like what is the funding process and why now? Why is now important?
So you can easily just type into any search engine members of the Senate Appropriations Committee, and you will get every senator and every state that they're from. You could also type in, members of the House Appropriations Committee, and it'll come right up. So all that information is easily accessible online. Same with the HELP. It's H-E-L-P. It stands for Health, Education, Labor, and Pensions Committee in the Senate, and the Subcommittee for Health under the Energy and Commerce Committee. You will also get all those members. They'll just pop right up. So it's really easy to see if your rep or senator are on any of those committees. Awesome. And if they're not on those committees, it doesn't mean you shouldn't let them know about pain. I mean, they need to know your issue and for sure educate them about this report. Every one of them signed on to CARA, and that legislation had this section in it. Also Representative Brooks, who unfortunately is retiring, but she's a big supporter, helped us in getting the Pain Task Force into the CARA legislation. So she's been very acutely aware of the work done in pain. So
great. Another question has come up from a few people, Crystal, Alexandra, and this is for Dr. Singh really, about how does cost factor into this report, and is the report going to be able to help move the needle on healthcare costs and being able to afford more integrative treatments like massage and all those things that are so costly for the average patient?
Well, look, so that's a super question. In fact, one of the key things that we recognized in the report was, number one, the overall national cost of of painful conditions, particularly chronic pain. It gets into the $600 billion plus range. And one of the big things is that the loss of productivity, economic activity. So if you think about ways to incentivize people outside of being compassionate about the pain and suffering, is that a lot of folks lose their ability to be productive, live an independent life, have dignity. And when you're able to see it from that perspective, you can see that coverage of some of the integrative health modalities of treatment, including acupuncture, which CMS just covered with their low back pain. They move at a snail's pace, but maybe this can be more rapidly addressed when you write to your congressman or woman and you're sending that letter. You also send it over to CMS and CDC and all the other folks. DepSec Hargan, another key person at HHS, he's second in command, who's really a big supporter. So Alex Azar, everyone's got kind of where they focus because it's such a large agency, but I just want to say that getting that coverage is really important, and that goes to perhaps appropriations, but also there is some ability over at CMS where they cover Medicare, Medicaid, and they're already aware. We have some really great allies there, but when they hear more from you, it makes a difference to them that the issue is alive and well and it's not forgotten, and it will make the case some more when you know that it's, whether it's massage, acupuncture, yoga, mindfulness, meditation, or more traditional neuromodulation, more, we need the whole toolbox of means to be able to get people back to functioning and feeling like they have some semblance of a quality of life. And when you write to them and you put in those economic terms, that actually is a motivating factor for some, not everybody, but for some who are really looking at this as pay some up front and you get so much more out of it later. Not when you deny, and then all of a sudden you have a massive issue in terms of the patient suffering, but really in terms of what medical care you can give.
Great, thanks, Dr. Singh. And I would add to that in addition to CMS and the work we've done with CMS, and we will let you know when their open comment period. CMS did have an open comment period back last September, but also don't forget that at the state level, insurers are controlled by the Division of Insurance. And so one avenue you can go is to go to your state rep or your state senator and ask for coverage of other options in addition to medication, so that people have that covered at your state level. So I think it's really important to also advocate for coverage with your own state rep and state senator.
That's awesome. We have a lot of people saying thank you to Dr. Singh and to Cindy, and also someone saying we should have an advocacy day every month. Yeah, and we have so many questions coming in. I don't know if we'll be able to get to all of them, but we'll take a few more. Let's see. Someone was asking, would it be worth contacting, insurance companies or, like you said, State Department of Insurances, also state medical boards about this report?
Absolutely. So
yeah. Go ahead, Cindy.
Yeah, I mean, the more you can make them aware. One of the things that we really want to get funding for is dissemination of this report to the nation's PCPs, because we know, and I know all the pain people living with pain know, that when you go see your PCP, they often don't know what best practice is in pain management, and the report so spells this out. And, HHS tried to disseminate it, but the task force disbanded before we could, do as much as we wanted to. And so, Dr. Singh, I know you'd be interested in saying something about how to get this out to doctors, particularly in your state. So,
yeah, so it's a really good question. So state medical boards are great because they're all, just think about the competing interests, American Heart Association or other people. There are so many different competing interests. So one of the things you can look at it is really you're fulfilling a duty, you're helping them by letting them know that this exists and that it's important. It wasn't just a passing phase. We put the groundwork in. It was a limited time that the task force was alive, which really should be true for so many things because you're able to actually concretely get something done. But now that dissemination part of it has to really come from different people at different levels. So yeah, the federal government has a role, but we know the public does too. And we need you to get out there, and it, like I said, it's more potent when you yourself are sharing it to state medical boards, to academic universities, to your own doctor, and then of course your representatives in that, and AMA and others. I mean, they were very, very supportive of this report. We had the president of the AMA speak. They gave press releases. Human Rights Watch did. So many different organizations that if you go and look at the report, you'll see what we mean. And I believe the public comments are still out there. So anyone that you're affiliated with in some way, whether it's a medical organization, your own doctor, or the policymakers, legislators, they all have a stake in this, and your insurance companies, because they need to know that the people who are their clients are having a hard time with this. If they hear it, it's the squeaky wheel issue on this.
Yes, excellent. Another really good question was, how does this relate to the landmark Institute of Medicine report from a few years ago? Is this sort of building off of that? What's the relationship there?
Yeah, I would definitely say that. So there's been a couple of landmark reports in this sort of history of pain policy. And really the first one was the 2011 Institute of Medicine report. And then subsequent to that was the National Pain Strategy. And then building on top of that was this report. So this report really is an updated best practices. I would say it's a more recent version of the kind of thing that was in the National Pain Strategy and was in the Institute of Medicine report. The numbers in this report are more up to date as far as the 50 million and the 19.6 million with high impact pain. And a lot of the data and all the research is more up to date in this report. So I would say this really takes the place of the previous reports that have been out there. So this is really the current report that should get disseminated.
And if I can just add, uniquely about this is when it came from a congressionally mandated need. That Congress asked this to be done. It wasn't just done in its own light. And also it was with other agencies. So it was a formal from the whole of HHS with the Department of Defense and the VA. And three, it wasn't just pain specialists or people who have some expertise in this realm. It was actually across the board in terms of different specialist expertise, different voices, again, of the veterans, of sickle cell disease, it's disease specific, condition specific, person specific, expert. It has all that, and that's what makes it really unique, in that we did build on those great efforts that were done in the past. But to me, I haven't seen anything like this, and I think a lot of our organizations that came out to support us noted that as well, that you could get all these different perspectives on board with one major effort isn't common. It's hard to actually get done even amongst the specialists, forget the fact that it was so many organizations. So it just gets back to why we want you to relay that very important point to Congress, that this is a very unique episode and opportunity that is so balanced.
Yeah, I have to say that I've been involved in a lot of these reports. So I worked on the National Pain Strategy and lots of other things. And this report was done the right way, and most of that is because of Dr. Singh. She included the patient perspective in everything we did and was very careful about getting everyone's input into this. And I think it's reflective in the fact that 160 organizations have backed this report. Unlike some previous efforts in the pain world, that were not as public, did not follow the administrative procedure as closely as this did, which is, get everyone involved, be totally upfront about what you're doing, and that's what, she did by ushering this through. So we have a big debt to pay to Dr. Singh for getting this report out and done so well.
Thank you so much. And we're continuing the fight, right?
Yes. Yes.
We're at it, as you know. Nothing's going to happen unless we make it happen. We, as people living with pain and people who care about them, We have huge numbers in our favor, right? So when we go in and advocate and say there's 20 million people with high impact pain, I get asked, well, if there's 20 million people, why are you the only one here? I mean, we've got to get out there and really be resounding. It's only people with pain that are going to change things because we have the numbers. And to Congress, numbers speak really loudly because numbers are votes. So, that's really important for us to all get out and advocate on the 11th. So everybody, get out and do it.
Yeah. And just a reminder too, it's hard because sometimes the government feels like alphabet soup, but HHS was overseeing this task force in the report, and they oversee the FDA, CMS, NIH, everyone. So that's why this report is especially different, not only in that it was done including patients and done in a very thoughtful way, but also it stands above other agencies, which is what makes it so important. And a lot of folks have brought up the CDC guidelines, and that's why, advocating for this report is important in regards to that as well.
Yeah, we pretty much have the CDC guideline. Like, I would like to believe, and I think this is very true, that direct results that came out were the forced tapering guidelines that came out immediately out of HHS right after we completed our report. And number two is this updating of CDC. We really left them no choice. It was a very fair, balanced, but scientifically supported review of the CDC guidelines. I mean, even though we knew how adversely affected people were, we really tried to be extremely balanced and leave them no choice, basically. So this is an effort of that, and it's already laid out in there, but really encourage all of you to go to that section, review of CDC guidelines in the task force report. And it's, I know Emily and Cindy, you guys will get that up there on the on your website, because those are, there's so much evidence and literature that we brought to bear so that it was airtight.
And I can just emphasize right now, there is an open comment period for the CDC. And I think one of the most important things you can tell the CDC is that if they want to know about pain management, they should look at the Pain Management Task Force report that was done. It really is state of the art with best practices. And that's where they should be looking to get input for any updates that they might do that affect people with pain. So be sure you mention that in your comment period for CDC. And we have information on the comment period.
Yes, please.
And like we said, we will add those couple of handouts from HHS about the report that you can share with clinicians or anyone else you'd like to. We'll look at adding some more specific information about who's on those key committees, so you can check that out as well. So stay tuned for those updates. And I thought it would be good to close on this nice question of, do you have any sense that the situation on the ground is going to switch to more compassionate care for patients, because there's so much, heartache and despair out there, and how can our stories kind of help create that change?
So one thing I want to say, and I know Cindy and I, we do this, we hopefully will be more coordinated. I think when I was hoping to rev up the post-HHS era, COVID had hit, but one thing that I know I do, and I know US Pain Foundation has done all along, is I highlight individual patient stories on my social media, and there's a lot of key interested parties who look at that. So that's one thing that if anyone, no pressure, of course, it should be de-identified or not, whatever is comfortable. But I think that allows real people out there who don't really understand. They actually surprisingly don't know unless you treat people. Sometimes there's assumptions and judgments made right away on someone who's complaining about pain. And the stories humanize it, which is the biggest potent tool in my view. You can ask Cindy. I would have the patient testimonials done and then take the vote right after. And like daring people to vote against what we were doing after you hear the moving stories, it was something that was so meaningful to me. I'm like, how can you, this is not, it's not a theoretical. These are people who are like of all backgrounds, of all types of different work or services, who have like come in. I mean, we had one person who had a severe disability, and she had it in her. We had such special transportation to bring her across the nation and she was determined to do it because she knew that it was really important for people to see her and hear her story. That was just really just typical. You know, again, you have a huge advocate and fighter in Cindy, and I'm just really grateful that we had that chance. But that's one big thing that I would say in terms of that last question.
Yep, be sure to tell your story. I mean, you have to do it concisely, but it's really important. It brings it home for people, and there's nothing like stories, particularly, you know, when it comes to politics. Politicians remember that. You know, these are people we really want to change their hearts and minds about this, and it's great to tell your personal story.
All right. Thank you so much. Well, it's 3:30, so I think we're out of time for questions. But Cindy, as you wrap up, I'll type in some answers to some more of them. Thank you guys all so much for your very insightful comments, and just a lot of appreciation coming from people for advocating for us, Dr. Singh, because we so desperately need voices like yours. So thank you.
Absolutely.
Thank you so much.
Yeah,
Thank you, Cindy. Thanks, Emily. I'll hop off now, but it's really an honor. Thank you so much.
Thanks so much for joining us. We so appreciate it, really. Thanks for all you do. You just help people with pain so much.
Absolutely. Thank you. Take care, guys. Keep up the fight.
We will.
We will. So anyway, we just really want to remind you that on Thursday, we'd like to just really blitz Congress, you know, blitz our congressional offices, call, email, tweet. We've tried to make it really easy for you. We've given everybody talking points. If there's any other questions you have, just write to us at this contact@uspainfoundation.org. We want to thank our corporate sponsors who have really been terrific in helping us put this whole thing together. We really appreciate it. And thanks so much for joining us. Definitely go to the US Pain website and participate on the 11th. And hopefully we will see your tweets and Facebook and email, and let us know if you hear back from your representatives. Take care, everybody. Bye-bye.
Thanks, guys.